Good day, everyone. I will be reporting our assigned topic, Lesson 6, Sexual Health and Hygiene. Definition of terms: health, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Hygiene refers to behaviors that can improve cleanliness and lead to good health, such as frequent hand washing, face washing, and bathing with soap and water. Practicing personal hygiene etiquette is difficult, especially in many areas of the world, due to lack of clean water and soap. Inappropriate washing of hands, face, and body can spread many diseases. Sexual health refers to a state of physical, emotional, mental, and social well being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Reproductive health refers to the state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. In all matters relating to the reproductive system and to its functions and processes at all stages of life. Introduction. Puberty causes all kinds of changes in the adolescent's body. These bodily changes are a normal part of developing into an adult. There are instances when these changes can be a source of anxiety to the growing teen. First one is oily hair. Each strand of hair has its own sebaceous or oil gland, which keeps the hair shiny and waterproof. But during puberty, when the sebaceous gland produces extra oil, it can make your hair look too shiny, oily, or greasy. Washing your hair every day or every other day can help control oily hair. Sweat and body odor. Perspiration or sweat comes from sweat glands that you have always had in your body. But thanks to puberty, these glands not only become more active than before, they also begin to secrete different chemicals into the sweat that has a stronger smelling odor. You might notice this odor under your arms in your armpits. Your feet and genitals might also have new smells. The best way to keep clean is to bath or shower every day using a mild soap and warm water. This will help wash away any bacteria that can contribute to the smell. So for odor in your arm under your armpits, you can use deodorants depending on the brand that your body would suit you. There are a lot of kinds of deodorants that you can choose to use when it comes to smells in your armpits. Then ay, body hair. Body hair in new places is something you can count on again. There are hormones in action. You may want to start shaving some places where body hair grows, but whether you do is up to you. Some guys who grow facial hair like to let it develop into a mustache and beard. Some girls may decide to leave the hair on their legs and under their arms as is. It's all up to you and what you feel comfortable with. If you decide to shave, whether you are a guy or a girl, you have a few different choices. You can use a traditional razor with shaving cream or gel, or you can use an electric razor. Good day, everyone. I am Medea Faye C. Cruz. I will be continuing the discussion of my co-reporter, Mr. Edwin Bacolinaw, for our topic sexual health and hygiene. Dental hygiene. Dentists say that the most important part of tooth care happens at home. Brushing and flossing properly, along with regular dental checkups, can help prevent tooth decay and gum disease. To prevent cavities, you need to remove plaque, the transparent layer of bacteria that coats the teeth. The best way to do this is by brushing your teeth twice a day and flossing at least once a day. Brushing also stimulates the gums, which helps to keep them healthy and prevent gum disease. Brushing and flossing are the most important thing that you can do to keep your teeth and gums healthy. Toothpaste contains abrasives, detergents, and foaming agents. Fluoride, the most common active ingredient in toothpaste, is what prevents cavities. So you should always be sure your toothpaste contains fluoride. Tips on proper brushing. Dentists say that the minimum time you should spend on brushing your teeth is 2 minutes twice a day. Here are some tips on how to brush properly. Hold your brush at a 45-degree angle against your gum line. Gently brush from where the tooth and gum meet to the chewing surface, in short, half a tooth wide strokes. Brushing too hard can cause receding gum, tooth sensitivity, and over time losing teeth. Use the same method to brush all outside and inside surfaces of your teeth. To clean the chewing surfaces of your teeth, use short sweeping strokes, dipping the bristles into the pits and crevices. To clean the inside surfaces of your top and bottom front teeth and gums, hold the brush almost vertical. With back and forth motions, bring the front part of the brush over the teeth and gums. Using a forward sweeping motion, gently brush your tongue and the roof of your mouth to remove the decay causing bacteria to exist in these places. The main reason for going to the dentist regularly every 6 months is prevention. The goal is to prevent tooth decay, gum disease, and other disorders that put the health of your teeth and mouth at risk. Health care check for the female. Keeping the external female genitalia clean. The best time for a self-breast exam is about a week after the last day of your menstrual period. When your breasts are not tender and swollen, this should be done at the same time each month when you no longer have your menstrual period. So for some girls, just like me, we can determine if ever our menstruation is coming or on the way. Just simply press where the part of your breast feels like feels like when feels like it hurts when you gently tap from bottom to top of your breast. So keeping the external female genitalia clean. Use soap and water to wash the external genitalia in your underarms every day, especially during menstruation. Use either a disposable pad made of cotton, which has a nylon base, or a clean piece of cotton cloth to absorb blood during menstruation. Properly dispose of the pad after each use, or wash and dry the piece of cloth used as a menstrual pad before use. Wash only the external genitalia. Do not try to clean the inside part of the vagina. While washing, wash starting from the vagina towards the anus. Do not wash from the anus towards the vagina. This will allow the germs to enter the inner genitalia easily and cause infection. Be aware of abnormal fluids from your vagina. Do not confuse this with normal vaginal fluids. If you see any changes in the vaginal fluid, a change in color or odor, please visit a health professional. Healthcare check for the male. Keeping the external male genitalia clean. Wash the external genitalia at least daily with soap and water, as you wash the rest of the body. Boys who are not circumcised need to pull back the foreskin and gently wash underneath it with clean water. Be aware of any abnormal fluids coming from your penis. Do not confuse this with the presence of normal fluids. If you see any abnormal fluid or wound, please visit a health professional. We have identified the important health habits for the developing adolescents to address the various changes that take place in a growing adolescent. Practical tips on observing good and healthy hygiene daily have been highlighted, as well as indications when to seek help, especially from a healthcare professional. That would be all. Thank you.